Hello, I'm Simon Barton. I'm a specialist knee surgeon based here at the Alexandra Hospital in Manchester. One of the procedures I offer here at the Alexandra Hospital is a partial knee replacement. The knee joint is made up of bone, cartilage and meniscus, and in some people the cartilage can deteriorate, leading to arthritis and pain. Up to 50% of patients that I see have arthritis that's located to only one part of the knee. A partial knee replacement is a procedure to replace the natural cartilage of the knee in only the one affected area. The advantages of having a partial knee replacement is that we can preserve all of the patient's ligaments and only replace the area that's damaged. The surgery takes less than an hour, is done through a small incision and has lower surgical risks than a full knee replacement. Patients usually only stay in for one night and have a better chance of returning to high demand work and sport. Importantly, having a partial knee replacement does not necessarily mean that you're going to need a full knee replacement later in life. If you'd like to come and see me for a consultation, you can book in online or contact the Alexandra Hospital directly.